Good evening. I'm John Bailey. This is People to be Heard, where people who have something to say have their say. Tonight, you've got Madeline Zevon of White Plains, New York, USA, a person who needs no introduction in White Plains, but she is a retired social worker and is currently healthcare chair for the League of Women Voters in Westchester and the League of Women Voters of New York State. Welcome to the program, Ms. Zevon.
Thank you.
It's a pleasure to have you.
Great to be here.
Right. And you are here because you and the League are advocates of a single-payer health program, it's the slide there, for New York State that they hope will pass the legislature this year. So, to begin with, tell us what the New York Health Care Act, which is known as, does.
Well, it would ensure 100% of the population in New York State, everybody would be covered. There'd be no co-pays, no deductibles, and no premiums. It would be paid for by progressive sliding scale tax based on income and non-earned income such as interest and that.
Mm-hmm. And what is the purpose of a forum coming up at the White Plains Library March the 1st at 7 p.m.?
Well, our main goal is to educate the public. That's the greatest need. And the forum is free and open to the public at White Plains Library. We will have a short film. It's a 30-minute film called Now is the Time, Healthcare for Everybody. And then we will have two speakers, Assemblyman Richard Godfried, who is the sponsor of this bill and has been for many years, but it's very close now, and so it's an exciting time. And the other speaker is Leonard Rodman, professor from well, you have his credentials.
Yeah.
He'll speak on the economics of the bill.
Right. Now, has support, as far as you can tell, increased or decreased from last year when you fell one vote short?
Yes. Well, it passed in the Assembly for the past 3 years. Last year's vote was 94 to 46. And in the Senate, we had 31 co-sponsors, just one short of a majority. Right now, there are two empty Senate seats, George Latimer's seat in the 37th District and Ruben Diaz's seat in the Bronx. There's going to be a special election for those seats on April 24th. And so at that time, we'll be back if they're both elected. We know they'll be the people running will support the bill. They have said they'll support the bill. So we'll be back to 31, still one vote short. However, we're hoping that we would get a Republican to vote for this. And in Rockland County, the Rockland County Board of Legislatures just recently passed a resolution supporting this bill, and all of the Republicans voted for it. So I'm thinking, maybe we have a chance. One of the reasons I heard that all the Republicans voted for it in Rockland is because Medicaid right now is paid for through county real estate tax. And that's a huge burden. And when this bill is passed, Medicaid funding would not come out of county real estate tax. And in Westchester County, 40% of the county real estate tax goes to pay for Medicaid, and that amounts to $286 million a year. So a lot of the Republicans like the idea that it would lower taxes.
Right. Now let's see, we have two things we can talk about as far as economics, nuts and bolts, either how much the average person would pay or the economic analysis. Which would you like to do first?
Well, I'll go through. All right, I'll do how much people would pay. So, if the person's income is under 25,000, there's no taxes, so they would not pay for the health care or anything.
Payroll deduction.
For 50,000, the employee would pay 30. If you earn 50,000 or around that, the employee would pay $38 a month for the insurance, and the employer would pay $150 a month. So the total would be $188. For incomes of $100,000 a year, the employee would pay $133 a month, and the employer $533. Then that total is $666 a month. For those earning over $400,000 a year, they would pay more. So it would be for the employee $900 a month, and for the employer $3,600, making a total of $4,500. Yeah. So right now we have a regressive tax for insurance. So the CEO who earns $400,000 or the secretary who earns $50,000 would pay the same. So that's the difference between a regressive and a progressive tax. It goes according to a sliding scale of their income.
Right. Do you feel the governor would be willing to sign this bill? Governor Cuomo.
Well, if it has the majority in the Assembly and the Senate, I think he would. Recently, he was on the Brian Lara show on NPR, and the governor said, it sounds interesting.
It sounds interesting. Very cagey.
I mean, yes, he is. But he sounds like he's open to it.
Right. In your opinion, does the single-payer Medicare for all, Medicare and Medicaid, insulate New York State from any future cuts coming from Washington in Medicaid? Since we supposedly pay it ourselves with this new plan.
Well, the plan is for Medicare, federal Medicare funds and Medicaid funds to be rolled into one entity, the New York Health Trust. In a way, it
looks like it.
Even if we don't get we have to get a waiver to roll those funds into the New York Health Trust. But if we don't get a waiver, the federal government would still be responsible for Medicare and for
so you can still cut it, and the graduated tax, if it becomes law through this bill, would have to make up the difference anyway. So it's
covered.
Yes. Okay. So, is it likely to be challenged by insurance companies if it is passed?
You bet.
Yes.
This would mean there would be no private for-profit insurance companies.
The biggest health market in the world is New York State. Right?
Yeah, they definitely, and they're very powerful. And so is the drug companies, because the New York Health Bill would be able to negotiate with drug companies to lower their rate. Now, even in Canada, they pay 40% less for their drugs than we do, even though they're manufactured in this country.
Drug companies aren't going to give
They're
you
not
40%
gonna like it.
back.
Yeah. No. Now that's why I mean, certainly they have a lot of money, the very strong lobbyists, and here we are, volunteers through the League of Women Voters. But I must say, there is a strong movement for this. We're part of the campaign for New York Health. So we're just one of the 200 entities. There are unions, there are so many community organizations, so many groups that are behind that. So we have the people We don't have the money.
Yeah. Now, there has been an effort of the state to rein in Medicaid. The governor created a panel to find savings in Medicare. We haven't heard any suggestions from that. In what, 2, 3 years?
Yeah.
He's had this going. Now, there has been no report. Has there been one at all that you know of?
No.
Or, no.
No. But this would rein in the costs for sure.
I see. But who
Maybe
would
that's
do
why
the
the governor
negotiating?
likes it.
Who would negotiate with these companies? Would there be a commission?
There would be an entity, and it would be made up of representatives from doctors and hospitals and the state government. So this would be a commission that would make these decisions.
All right. Now, the state already has the power to audit hospitals, doctors, prescription companies on costs, but the cases of bill inflating have been few that have been brought by the authorities. If the state cannot get tougher on fraud in hospitals and doctors who inflate bills, which I know for a fact happens, is it anticipated that the state will be able to bring hospital costs under control, doctors' fees reasonable, all the factors that drive costs up exponentially.
That's right. All of that would be part of this commission, made up of all the important constituents.
Now, the question is there an apparatus describing how this commission would be made up and their powers
Yes.
There is. Tell us about
It's
it.
all available online. If you go to NYH, that stands for New York Health, nyhcampaign.org. And on that website, you will see the bill, you will see the economic study, you will see there's a wonderful new film on the website. It's a brand new website. They had a website, but this is an improved one. And any question you have will be answered if you go to that website. We should probably put it on the screen. I'm sorry.
We'll take care of it.
nyhcampaign.org.
Okay. Now, in order to insulate themselves from adverse effects on Medicaid, care-providing organizations, particularly for the disabled and the persons receiving services on a regular basis, have formed an organization called Life Plan CCO of New York, and it consists of 60 organizations which now coordinate together to serve the disabled and work with one another. Now, they're having a meeting coming up to tell parents of the disabled and persons with disabilities how this would work. What state authority will tell providers no if your fees are too high?
Well, I guess that would be the work of the commission, and I'm sure the disability field would be part of that.
And the hospital oligopolies now being formed, it seems, every other week by mergers like New York Presbyterian Hospital and Hudson Valley Hospital at Montefiore and White Plains. How do these affect state negotiations for what we presume will be lower rates? So, are they behind it?
Hospitals and doctors would remain as they are now, whether they're an oligarchy or
oligopoly.
Oligopoly.
Yes, right.
Or a private practice, whatever. So this does not affect the status of whatever groupings they have now. This bill is public-private, so private will remain like Medicare. I mean, hospitals get funded by Medicare and Medicaid, and doctors get funded by Medicare and Medicaid, and they'll continue to. That's not going to change. The only thing will change is the administration. In other words, the hospitals would send their bills, or there might be even a global fund. That's part of it. And the administration would be done by the New York Health Trust Fund.
I see. Now let's see, you have a list on your left. There's a poster there talking about the advantages of this bill if
Yeah.
all works out according to plan.
Yeah, I'd like to go into that. Okay, this is the economic study that was done by Gerald Friedman from the University of Massachusetts in Amherst. And it shows how much would be saved and how much would be cost, how much would it would cost to insure everybody, because right now many people are uninsured or underinsured. So, and then it shows the net savings. Okay, so 26.5 billion would be saved by eliminating insurance administration and profits.
You're not going to like that.
Believe it or not, private insurance company spends 20 to 30% of each dollar on administration and profit, compared to Medicare, traditional Medicare, which spends about 2 to 3%. 20.7 billion would be saved by reducing medical practice insurance administration. Doctors and hospitals have to hire many workers to process claims and fight for reimbursements. This is very costly. There's a every insurance company has their own rules, and it's a very extremely complicated and costly thing to process claims. 2 billion would be saved by eliminating employer administration. Right now, employers have to negotiate with insurance company to cover their employees. So this will be out of their hands. You know, they still would be paying the tax, but they don't have to buy private insurance for their employees. 5.4 billion would be saved by reducing fraud. Sometimes there's accidental duplicate billing because of the confusing nature of the insurance process. If there's fraud, if the fraud is deliberate, public authorities would have greater subpoena power. So, and another giant savings, 16.3 billion, this is all a year, would be saved by overpriced drugs and medical devices. And New York Health would be able to negotiate with drug companies to lower costs, so that the total of savings would be nearly 71 billion
a year.
A year, and the cost for to meet increased coverage would be 26 billion. And so if you subtract the 26 billion from the 71 billion, the net savings would be 45 billion a year, nearly $2,200 per person. And over 98% of New York households would spend less on health care. And get better coverage, by the way, because this would include hearing aids, substance abuse treatment, mental health treatment, vision, and long-term care.
Existing conditions.
Yeah.
Well, this sounds too good to be true. How come you're so close to passing it?
Yeah, because it's good.
It's good, right. Well, this is extraordinary, this listing of savings. And what intrigues me is if it's a payroll deduction process.
The way Medicare is
it certainly would seem to be easier than the extraordinary fluctuation in healthcare rates depending on how much more money the health providers and insurance companies want to make.
It's simple.
Yes, it is simple. The state would presumably pay all bills. Would it also have conditions the state would not pay, as insurance companies do?
Well, if they thought there was fraud or that, well, yeah, I'm sure the commission would. But right now, insurance companies, in order to build their profit, denial is a big part of what, when you're processing claims. Very little Medicare is much less. So
Yes.
as far as turning down.
Are the attorneys that specialize in medical malpractice and medical suits and trying to get suits will help people get services paid for? Are
Well,
they behind this bill? It would seem that is not in their best interest.
I don't think it's in their best interest because
Yeah.
one of the major reasons for large suits is to cover the medical treatment for whoever was harmed or injured. This is guaranteed lifetime health care treatment, so that you know the lawyer would not be suing to cover the costs because it's already covered, whatever the costs are.
Yes. Now, you're very close to getting this passed now. Has there been a rush by the companies and interests that are really going to be hurt, or rather, their gravy train taken away by this?
I'm sure there is. I have to tell you a little funny story because I was up in Albany lobbying last year. We have a special lobby day. This year it's June 5th, before the end of the I think they're holding it off to get as much support before the session ends. But I was on a lunch break and I was sitting next to a man who I didn't know who he was, and I was telling him about the New York health bill, and I was, you know, all enthusiastic. And I asked him what he did, and he said he works with a hospital association. And so that just went right over my head. But then some friends of ours who saw me sitting with him said, he's the head of the New York State Hospital Association. And he told me he thinks this will pass within the next year or two. So I think because of the fact that it's so close with the vote, but the fact that the people are behind it, this is very popular. It's health care is the #1 issue in the country right
now. And everybody's worried about it.
Yeah.
Considering
right.
what they're planning to do with Medicaid.
Yeah, and so I think they see the writing on the wall.
Yeah, I see. So, business. How are the major business organizations, which fought bitterly against a commercial real estate tax rate, how do they feel about this? Do they feel companies will save money, or are
some
they worried?
do. Some do. I was when I was lobbying. I was with a businessman. He had a company in Ithaca for medical appliances, and he had a subsidiary in Canada. So in the United States, he paid twice as much for the insurance for his employees than he did for his employees in Canada. But he said he's not leaving the United States because for 35 years he's built his company here. He still has a lot of the original workers, and even though he's paying twice as much, he's staying. So, you know, he was very ethical about that.
Well, we do have excellent health care in this country.
We do. We do. It's just that it's not,
The
it's very
availability
costly.
is the problem, and the cost is
Yeah, I mean, there's no question we have the best hospital care in the country. But is it available? Is it affordable? And that's
no. It's not. So listen, the forum again is March the 1st.
Yes.
If people want to learn about this,
Right.
and what can the average person do to help their representatives do the right thing?
Learn more about it so that you understand it. Go on the website, nyhcampaign.org, and encourage your legislators. I mean, we're very fortunate in Westchester County as far as our legislators being in favor of this. It's mostly upstate New York and Long Island that, but I think urge your legislators to vote for it. Right now, in Westchester County, the Board of Legislators, who has formally given us a memorandum of support, we're now in the process of getting a resolution, such as they got in Rockland County. Putnam County is also working. There are several counties around the state that have already given a resolution in support of this bill. So it's a grassroots effort. And I think, you know, speak to your friends, any groups you have. If you want a speaker, we have speakers through the league, through our committee.
Who they call if they want a speaker?
Yes, they can call if they want a speaker.
And a number? Do you have it?
Oh, well, you can call me, Madeline Zevon, and the number is 914-584-9968. And I've spoken at many groups. We have several people on our committee. I have a large committee that we meet every month, and we're writing letters to the editor. And I encourage anybody to do that as well. Op-ed, I have a big article in this week's Examiner. It's in the newspaper. It's in the newspaper, and it's in their paper edition and online. And also, they're going to have the flyer in the online in the Examiner.
Okay. Another question: is the how long will it take to actually go into effect? The new payroll deductions and all that.
It'll take a year. It'll be completed.
A year.
Yeah.
That's fantastic. A year.
Well, you know, Medicare in the 60s took 1 year, and that was before computers. So this will take 1 year.
Yes, there's nothing Americans cannot do. There is nothing Americans cannot do. And now, once again, Madeline Zevon, chair of the Health Committee for the League of Women Voters across New York State. You have been heard. And Westchester.
Okay.
Right. Thank you very much for being on the program.
It was a pleasure. Thank you for having me.
Mine too. John Bailey, good night for People to be Heard.